Hi, I'm Supervisor Jay Schneiderman, and welcome to Talk of the Town, where we take a close look at issues facing our community, and we meet some of the individuals involved in responding to those issues. And today we're going to be talking about opioids and opioid addiction, and I'm joined by two individuals, Nancy Lynett, who is our Director, Southampton Town Youth Services, and Mark Epley, who's the CEO of Seafield, which is Addiction Recovery Services. And Mark, I'm sure, will tell us more about Seafield in a moment, but let me talk first about the opioid epidemic. I know you hear a lot about it in the news. We in Southampton Town were hit pretty hard with deaths related to opioid use. In 2017, we lost at least 19 members of our community, and some of it to heroin, but also other opioids, and that was far too many, and it kind of shook the community. It's a community of 60,000 people, and particularly when young people are dying, you go, wait, this shouldn't be, and particularly when these are, preventable deaths. There's no, it's one thing if somebody has a disease there's no cure for or whatever, but this is clearly preventable, and it led to the creation of a task force, an opioid task force, and both of you served on that task force, and thank you for that. We put together what ended up being, I think, a 42-member task force to develop recommendations. What should we do? What should we do locally? And recommendations for other levels of government, and including state and federal. And Drew Scott, of course, formerly of News 12, co-chaired that committee. Drew had come to me pretty much in tears after his own granddaughter died, and said, Jay, I really want to do something. I can't bear to see another child die a preventable death. And I said, well, would you work with me, and let's see if we can come up with some answers. So Mark, maybe we'll start with you. You've been at this for a while. This is not a new subject. This is what you do for a living. I knew you as mayor for many years of Southampton Village, where we worked together on various things. But even then, you were with Seafield. And so tell us a little bit about Seafield and your take on this opioid epidemic.
Well, I've been in the addiction field for 26 years. And Seafield actually is have a 100-bed inpatient alcohol and substance abuse treatment program located in the village of West Hampton Beach. Been around since 1985, and then we also operate 6 outpatient treatment programs across Long Island, and we also have 15 sober houses that we operate. So we have about 350 employees, and we treat on an annual basis in the inpatient program about 2,400 people. And on the outpatient, we treat about 5,000 people. And it's addiction is a family disease, is really what it is. And so we're talking about the opioid crisis now. In my 26 years, I've watched a variety of drugs become the crisis. And I always I talked to you about this at the when we did our presentation to the town board about addiction. So basically, it's 11% of the population has an issue with addiction.
Is that today, or it's always been?
It's always been that way.
See, I think it's interesting. I remember you saying this at one of the meetings, and it kind of surprised me, is that there aren't more people addicted, or more people with addictive personalities or predisposure. Well, right?
How do you know? So it's basically 1 out of every 10 people.
1 out of every 10 people. And historically, it's always in it. So what's different about today?
Well, today we're dealing with an opioid crisis. And the reality is that you actually don't have to be an addict to overdose with opioids. And that's the scariest part about it, because young people that will use in a party situation, whatever, and they'll die of an overdose. And also, we're having the conversation at a national level. Politicians are stepping up, municipalities, they're all stepping up, partly because it's hit white middle-class America. And that's one of the issues. So, from my standpoint, when we talk about addiction, you want to get into prevention and education. You want to get into treatment, and then the law enforcement component to it. So all of those different areas, and I don't care what the drug of choice is, any opportunity we can do to educate young people to help them make better choices in their life. And because you're always going to have the struggles with addiction, and people are going to reach out, and there are going to be people that want to change, and then there are people that are not going to want to change. Alcohol.
But it seems to me that, yeah, that may be true, that people are prone, they're going to get addicted to something, a painkiller or something that kind of distracts them from their depression or whatever it might be. It's just that it just seems a lot more lethal now. Like that these substances, particularly fentanyl, that is sometimes present in heroin and maybe some other drugs. And sometimes you don't even get a chance to get addicted. You're dead your first use. Yeah. Right, so I think we're seeing a lot more mortality, even though maybe not more people who suffer from addiction, but more of them are dying.
Well,
is that not true? Or?
No, well, what I would say to you is that 64,000 people lost their lives from an opiate overdose last year. At the same time, 88,000 people lost their lives due to complications due to alcohol. 480,000 people lost their lives due to complications of tobacco use, and those are all drugs: nicotine, alcohol, opiates.
They're all addictive.
And they're all addictive.
It happens in a less shocking way.
Right.
People get sick for a long time, and it culminates in a death, as
certainly
opposed
alcohol
to something
can be
that,
fatal in lots of different ways.
absolutely.
And so you talk about opiates now. You have fentanyl-laced opioid. And fentanyl that will kill you would be basically the size of the head of the pen, if it's laced in there. But they're lacing marijuana with fentanyl today, and there's a lot of so it's fentanyl is the killer, and trying to control that, police it, educate. And people who buy street drugs, you just don't know what is in the street drug today. So it's really scary. It's an epidemic, and the more that we can talk about it, the more we can bring awareness to it, the more that we can educate young people on how to make better decisions in their life. Maybe we can prevent some stuff.
Now, Mark, you chaired or co-chaired one of the subcommittees, right, on the task force. Which was that?
The recovery.
Recovery.
Yeah.
Now, that was actually, when we started out, we had 3 committees, and we ended up with 4.
Yeah.
Initially, recovery wasn't its own committee. It was part of treatment.
Yes.
And then a number of members felt that recovery should have its own committee. Why is that? Why is recovery different than treatment?
Well, treatment is something that's done at the beginning stages. So recovery is all about developing tools for long-term sobriety and cleanness. And so you, AA, and 12 steps of AA. I mean, my father-in-law has been in recovery, and I'm not breaking anonymity because he'll tell anybody, for 42 years. For 42 years, the man has gone to anywhere between 3 to 7 meetings a week. Huh. And he developed a home group, and he sponsors other people. He's taken on commitments and rolled out in the middle of the night to someone to a detail. All of those things that are part of giving back and being part of a 12-step. And so when you look at recovery is different, because treatment gets into developing a treatment plan and developing a plan for your life and how I re-engage in society and pulling family in. And
so it's not like no cure for addiction, kind of. It's a kind of an ongoing.
You have to develop a lifestyle that focuses around the recovery.
Right.
Right.
And it's a family disease. And there's Al-Anon and Alateen that are support networks for family members, and encourage families to get involved. And I mean, it's like everything else. You want family involvement. I don't care if it's sports or if it's
Sure.
whatever, school, family has to be involved.
When you consider
Go ahead,
that 1 in every 10 people have an addiction, that's every single family being
Pretty
affected
much,
by
yeah.
that.
Yeah.
So there really is, there's no, it's everybody in our community that is affected
Sure.
in one way or another, some more seriously than others, but it's devastating for every family,
Right.
I think.
And now, Nancy, you were co-chair of the prevention?
The chair of the prevention committee.
Chair of the prevention committee, and that largely focused on keeping people from getting started, right? Is that on this opioid path? And it seems like a lot of people get started when they get prescribed prescription painkillers.
That's one of the
Oxycontin.
paths, certainly, to opiate addiction, is being treated for something that, a surgery or an injury
Right.
that involves pain. So that is how some people
Other people
start doing
seem
it.
to take other paths, gateway drugs and things like that, and they experiment. And I think when I was younger, it wasn't so accessible. Maybe heroin. All the images we had of the junkies by the railroad tracks, shaking with
Right.
withdrawal symptoms, and
Right.
it's like nobody would even think about.
Well, that was in the
then
heroin age.
suddenly heroin became like easy to get, cheap, easy to take, right? It's I guess you don't have to inject it. I don't know much about it, but
No, it is. It's relatively easy to get. Heroin, of course, is cheaper, which is why people move from the synthetic prescription types of opioids to heroin, because
it's hard to believe that
lot
an
less
illegal
money.
drug would be cheaper.
Yeah.
Well, I mean, part of the reason why we're sitting here and talking about opioids is, they had the Pain Relief Act from 1999.
Exactly.
Which was signed by President Clinton and put in place. It forced all hospitals and doctors to address pain. And so if you go to your doctor and you have a pain in your shoulder and they'll ask you on a pain scale of 1 to 10, what is it?
That's when they started those smiley faces on the hospital
So they were
walls
sort of
about tell us
directed
where your
to-
pain is, to relieve pain.
To relieve
To relieve
pain.
pain.
And
That was
opiates-
success if people didn't complain that
Exactly.
they were in pain. So the doctors then, to meet this mandate, would overprescribe these highly addictive painkillers.
Right.
And then people would love that feeling, I guess. It's euphoria of some kind or whatever.
Trying to solve
and
one
they'd want it,
problem.
and then they'd go and look for somebody who had Percocet or Oxycontin or Vicodin,
Well,
whatever.
opiate is the second most addictive substance behind nicotine.
Wow.
Behind tobacco.
That's interesting too. So nicotine's actually more addictive than
Oh,
these
yeah.
Oh, yeah.
substances.
Look at a smoker.
Yeah.
A smoker stands out in the rain and the snow to smoke, or 900 miles an hour wind, to have a cigarette at 9:15 in the morning.
Yeah.
Smokers are on breathing machines and smoking at the
Right.
same
Even though it
time.
says right on the packet that it could cause lung cancer.
But it's addiction.
Yeah.
It's addiction.
It changes the brain.
It's fascinating
Once you
how it
start using these drugs, you
overrides-
start changing your brain, and then that dynamic just keeps sort of snowballing.
Right.
And so,
Right. So now, let's get into a little bit of some of the recommendations. So maybe we'll start, Nancy, with you with prevention. What are some of the things that the committee thought might be helpful in keeping people from going down this path?
well, the prevention committee really focused on two main types of strategies, and one is community education, and the other is services that are targeted to meet special needs of young people in particular. So first I want to say that prevention is kind of where it's at with addressing opioid addiction, because it's so much cheaper to engage in prevention activities, and it doesn't lead people down a path that's causing them and their families tremendous pain and anguish.
Right. It's really
So
hard to get them
that's-
off once they get started.
Exactly.
Not impossible, but hard.
Right.
And like you said at the beginning, it is a completely preventable problem. So that's where we really want to be focusing our resources in the view of the prevention committee.
All right, so how do we do that?
So I think we focus, like I said, on education, and that's community education. It's working with prescribers on alternatives to prescribing opiates or ways to prescribe them that are safer. It's working with parents, helping them understand the challenges that kids are facing when it comes to making decisions about using opiates or other substances. It's helping parents understand what strategies they can use at home that are most effective. It's helping them understand the environment their kids are living in and really what's accessible to them. I don't think a lot of parents are always aware of what their kids actually have access to, not just in the way of substances, but in the way of information and everything else. It's providing education for community members. One of the things that we've learned with our work with kids over the years and doing surveys of young people and their opinions and attitudes and how they perceive their community is that they're being influenced by every adult around them, not just parents and not just teachers, but every adult that they come in contact with is a source of influence for them, and it affects the decisions that they make. So I think everybody has to kind of understand that there's a role for everyone in getting on board the prevention train, more or less, and how we are, how we're interacting with kids and how the kinds of services that we're providing for them. On the services to youth front, we talked to young people, high school age students, but we also talked to young people who are in recovery between like 18 and 30. And there were, one of the most important things they told us was that one of the things that led to their use was a feeling of not being connected to anybody, not having resources to go to, not having somebody they can talk to, feeling kind of alone out there in the world and not knowing how to cope with the challenges in their lives. So I think that another avenue we have to explore is how we can provide more support. How can we identify those young people at an earlier point in their lives? How much, what support can we be providing in schools as well as in faith organizations in the community and the kinds of clubs and things that young people go to? How can we help every kid feel a connection to an adult?
And did you get good participation from the schools?
We did.
Right.
Yeah.
And I guess churches too, right? So they, but in schools in particular, they're dealing with our children every day.
Schools
I
are.
think it's critical that they play a big role
They
here.
and they do too. They do too. I think there's a lot of focus on what can we do more of in school to prevent this problem. But I think that kind of ignores the fact that kids are being influenced in a lot of different places. And if we put all our focus on school, we're going to miss the boat. There is always new evidence about what's effective and what approach we should be taking. There's lots of research that can help guide this. And I think schools are working to keep up with it and try to offer effective programming for kids in schools. It's an ongoing
You've been doing
process.
surveys, right? Surveys
Yes.
within the schools, asking kids certain questions about,
We have.
anonymously if they've done drugs, which types of drugs. And what are you finding with those surveys?
Well, the interesting thing is what we're finding, we've been doing them every 3 years since 2002, and the most recent one was just December of 2017. And we are actually finding a steady decline in reported use of all substances
So that's
from
a good sign.
2002 to now. It is a good sign. So we are doing some things that are working. We just have to learn how to do more of that in a more comprehensive way. So yeah, I think it is a good sign.
What are the things that kids seem to be saying? Because I went to the youth forums, and some kids are saying we're bored. We're just bored, and it's
And
really
they
in
are.
that boredom they're looking for something
Yeah.
exciting, and maybe they end up trying
Well,
drugs.
I think
and
kids
things like
are
that.
bored. They are.
Is that something
But I don't
we're doing
think that's
wrong, or
one
can-
of the
can we-
driving forces.
Can we do something
Well, I
to
think-
provide
well-
activities for kids?
Yes.
Is that something that you guys looked at?
Yeah.
I also think that, they live in an instantaneous gratification society. So,
They get
when
jaded
we
very
were growing
quickly.
up, you went outside and played football with your friends, and you did different things. And
Sure.
kids don't do that. Everything has to be structured. It has to be constant stimulation. It has to be
New and
delivered
exciting.
in 146 characters, and it's
Yeah, it's
everything's
hard
at
to
the
give
tip.
them the same level of stimulation as a
It
video
is.
game is going to give.
I mean, it
Exactly,
is,
and the same
yeah.
level of excitement and risk and everything else. So,
Yeah.
but I honestly I think that boredom plays a minor role, but I don't think it plays an overriding role. I do think that, and actually a lot of different communities have put together programs that really focus on keeping kids engaged all the time in activities that they're interested in. And I think we can, as a community, offer a broader array of programs for kids to get involved in and make it more accessible to them. There's a whole population of kids out there who can't afford dance classes or karate instruction, or maybe they can afford it, but they have no way to get there.
That's where the town kind of steps in too, right?
Exactly.
Because we do provide some transportation. We do provide
We
some
provide
affordable,
some transportation. We
affordable
provide
activities.
We provide karate at a reduced rate. In one of our youth centers, we are doing free chess instruction, which actually kids are very interested in.
Good.
So we'd love to be able to do more of that. I think
Sure.
that that's important. I think, and just helping those kinds of services be more accessible to kids, maybe, supporting organizations in a way that they can offer more services for less money. Because I think, kids need to feel like they're engaged in something that they feel good about, that they are interested in, and that's important to them. So when you only have a few things to choose from, that may not be the right thing.
So now, Mark, let's switch for a second to recovery. And what are some of the recommendations that came out of that recovery committee?
Well, I think the big recommendation, which came out of the treatment and the recovery component, which I think is a realistic goal for the town of Southampton, is a facility like the Thrive facility that the
What
task force.
is that? So
Well,
a
it's
lot of the
a,
viewers are not going to be familiar with Thrive.
So the state of New York, through the Office of Alcohol and Substance Abuse Services, help fund basically drop-in centers at a variety of places across the state. And the purpose behind that was that, you could go to 12-step meetings, you could get information on treatment programs, you can hang out and talk to other people that are in employment opportunities and all of these different things. It was a lot of stuff, and it was really it was a grant money from the state, and I was involved with them. One of the biggest difficulties that we had was site location. You actually couldn't find a landlord who actually wanted to rent property to the organization, and so we did find a landlord, and up in Smithtown, Hauppauge area, and we've got a very successful program that's up there, and it's funded by state grant money, but at some point in time it'll have to become self-sustaining. And I think that we need something like that on the East End.
So this is for people who are in recovery, who want to stay living a healthy lifestyle, pretty much?
No, it's not just about people that are in recovery.
Or people that want to participate in activities that are drug and alcohol free.
Okay, so it's not simply, it's not
It's
just
not
or
just
exclusive to those people.
It's not exclusive to people that have been in treatment and to people that are in recovery, and it's not exclusive to family members.
It's just basically drug and alcohol free activities.
Right.
And related to Thrive, the state also has a program called Clubhouse, which is geared toward young people.
Yes.
It can either be like 18 to 21 or 18 to 24, but it offers a similar kind of service for young people in recovery.
If you're below 21, you can't legally drink, but you might want to socialize, right?
Right. But they're also available to young people who are at risk of addiction. So that is something that I think would also be really appropriate in this community. And
I've heard people say to me like they'd love to, go to a place to hear live music and hang out with people that didn't have alcohol.
Yes, exactly.
Because they're afraid of that temptation. So.
And when you talk to young people in high school, for instance, there's always that group of young people that talk about how they don't feel like they fit in socially because they're not using alcohol or other drugs. And they don't feel comfortable oftentimes at social events at their high school because they're choosing this lifestyle that they see as different. The interesting thing is that the vast majority of high school students are not using. But,
Right.
but when it comes to the social scene, alcohol and other drugs do tend to be used more in that setting. And
I mean, we are a resort area out here on the East End, and they're exposed to, kids are exposed to a lot more than many other people
Because
across
people
the
are coming
country.
out here on vacation.
They're on vacation, they're coming out from the city, they're hitting the nightclubs, they're
Right.
partying, they do.
Right, they've worked
And
all
we-
week, they're coming out here to relax and party
we
and have a
have-
good time,
Yeah.
and that's what the kids see. They see this, you know.
we
this
have a lot of
free
alcohol
spirit,
outlets
this,
too.
you know.
Very dense in alcohol outlets,
Yes.
much greater density
Sure.
of places to go buy alcohol than most communities
Right.
do.
Right.
Also a contributor.
So
It
now what
is.
about, you know, Mark, I know that before was the recovery committee, you were part of the treatment committee
Yeah.
too. And I hear there's like a lot of issues around treatment in terms of like not people who get, maybe they've had an overdose or something and they end up in a hospital and then they get assigned to a rehab facility and they only treat them for a couple days and it's like not long enough or there's not enough beds. They have to wait for weeks to get a bed. Can you talk a little bit about the availability of beds, that issue, and that issue of whether the insurance companies are paying for enough time to adequately, you know, get past that crisis moment?
Well, so New York State and Governor Cuomo and the legislature have really done a phenomenal job in the last 3 to 4 years. And the New York State Office of Alcohol and Substance Abuse Services has done yeoman's work on their leadership around that. Because, you know, 4 years ago, someone who would try to get into treatment and the insurance companies would say, well, you haven't failed an outpatient, a fail first mentality. So you were putting someone's life at risk when they were trying to access treatment. So it's the whole pre-certification process. Like if you're going to have surgery in a hospital, you have to go and all the pre-op stuff
Right.
and pre-authorized approval. It's the same thing in addiction medicine too. And so the state passed quite a few laws. It's eliminated fell first. They put a minimum of 5 days for an individual detoxing before an insurance company could actually do a review. There's a minimum of 14 days of an inpatient stay before the insurance company can actually do a review. They also developed a tool. It's a level of care determiner that OASIS put together that you sit down with a professional and you go through a whole series of questions, and at the end, based upon your answers, it helps determine what the appropriate level of care is for you, whether that's a detox in a general hospital, an inpatient treatment program, a residential program, an outpatient program, or intensive outpatient program. It helps set that, and then based on that, the insurance companies have to follow that guideline, which is groundbreaking across the United. I mean, what New York State did in their leadership role just helped significantly. So those are some things they put. The I-Stop program where they
That's
the
great,
prescribers and so yes. So from an availability standpoint, outpatient treatment is always accessible. You know, there are a variety of programs on the East End that are very good quality programs that you know I work with. We have some. Seafield has one in Riverhead, and then Catholic Charities, Alternatives. You know, Eastern Long Island Hospital in Quonset has some. At Long Island Center for Recovery, and then there are inpatient programs too, which are the longer stay. There's Long Island Center for Recovery. It's Seafield Center in West Hampton.
Sure.
But I think one of the biggest challenges is detox. So somebody who actually goes into an emergency room under the influence, and it's 3 o'clock in the morning, and so what are the emergency room doctors and nurses? How do they manage that individual? So because of all the assessment processes and stuff, it puts roadblocks in place for somebody trying to get to that. So, you know, if there's an opportunity to do detox beds in general hospitals with
Yeah, that would help. Right?
would help. You know,
So those are the things I
yeah.
think we have to start looking at.
and they are. I mean, Stony Brook and Southampton hospitals. Looked
So
at
now
it
you're going to
recently.
stay involved. So we took this opioid task force. You know, it did its job.
Right.
It filed its recommendations, which were available for anybody to take a look at. So we're now moving forward and trying to implement them, and we've created a new committee, which I think is called the Addiction and Recovery
Yeah.
Committee, and I think you're both going to serve on that,
Yes.
right?
We are.
So,
Yes.
so now it's kind of about taking these ideas and putting them into action. And Mark, it sounds like some of them already are in motion.
Yeah.
It sounds like a lot of good things are happening at the state level and at the local level. So again, I'm going to look forward to working with you guys as we move forward. I'm going to try to stay involved with that committee too, because although, you know, there's good signs, I have to say, like I mentioned the 19 deaths from last year. By this time last year, we're like, you know, halfway through the year, I think we were about 14 or 15 deaths. This year it's one. That's
Yeah.
one too many, but it's significantly improved over last year. I hope that trend stays.
Yeah.
I hope we don't see any more deaths this year. But to keep these numbers there, we're going to really have to stay very active. And I look forward to working with both of you. And you know, if people want to learn more about Seafield, I'm sure it's something they can find out information easily.
We're on the web, seafieldcenter.com, or 631-288-1122. That's our main number. And I do want to thank you, Jay, and your leadership at the town level and
Appreciate
the town
that.
board for everything, and every member of the 42 members of the committee.
Yeah.
And I'm excited about the new task force, the Addiction and Recovery Task Force, which we're actually having our first meeting on Thursday, and I'm really proud of OASIS, our licensing Office of Alcohol and
great.
Substance Abuse Services, and their willingness to get involved and their leadership. And I said it already with the governor and the legislature, and they really have been incredible. We're lucky to be in New York State
Sure.
at this time, really addressing
Well,
the
that's
issues
good.
around
Yeah,
this.
kudos to the governor,
It really
too.
Well,
is.
yeah, to have the support that you need to carry out the work you need to do is great.
And that's, you know, your department and all the youth services, it's something that people can take advantage of.
Yes.
Kids, parents of children, if they want to get them plugged into good, healthy activities. How do they find out more about what you do?
Well, the easiest way is probably southamptontowny.gov/youth bureau. You can learn about all our activities. You can call us at 631-702-2425. And we're always innovating, doing new things, adding things to our agenda. So we're also open to ideas.
All
If
right.
the
Well, thank you for
community
coming
has
on the
that.
show.
Great.
Mark,
Thanks.
always good to see
Good
you.
seeing you, too.
And thank you for
you.
watching Talk of the Town. We'll see you next time.
Thanks.